I recently published a paper in the Aesthetic Surgery Journal on neck lifting after non-surgical treatments, describing the complexity of surgery due to the fibrosis and scar tissue. Well, there is a well-known Substack writer, Jolene Edgar, who you might know from Allure magazines, where she contributes articles. She picked up this paper and wrote about it in Facelift Follies in her Substack collection, which I would recommend you subscribe and read her papers. She has so accurately described the neck lift impact of the skin and what happens in these non-surgical treatments. She describes how the neck skin is different from facial skin. It's quite delicate, with a very delicate underlying tissue and fat that covers up the platysma. And this becomes corrupted with age. And then when we do non-surgical intervention, we're actually prematurely corrupting this soft tissue, the skin, the deep layers of the skin, and the fat, which prematurely shows the underlying structures. She also very accurately points out the impact it has on future surgeries and services that we may provide, trying to enhance the appearance of the neck. It creates scar tissue, making the surgery much more difficult. And we wrote the article for surgeons so they would understand what to expect when they go into these necks and how to prepare for the complexity of the surgery. But it's also directed toward the consumer so they understand what has happened. And as Jolene Edgar also points out in her paper, it's very important for the patient to disclose to the surgeon that they've had anything done to the neck, whether it's injections with Kybella or injections with things like Radiesse biostimulators, cool sculpting where you're trying to actually melt the soft tissues, in particular the fat, or particularly energy devices, which can destroy not only the underlying soft tissue, but it destroys the fat, scarifies the platysma, and makes any future surgeries much more difficult for the surgeon and increases the risk for the patient, including skin loss, irregularities, and potential nerve injuries, which can cause the lower lip to move differently. So it's very important that the patient disclose this to their doctor before surgery so the doctor can then be prepared to deal with these problems and anticipate potential problems.